Hi, everybody. The question posed for our final group discussion was to discuss some ways we as counselors can evaluate and document the effectiveness of our group to make discussions for future groups. There are several ways to evaluate the effectiveness of a group. However, to evaluate the effectiveness of a group, the counselor must first have a clear purpose, rationale, and goals established for the group by which to measure the group's success. First and foremost, after every group session, the counselor should assess his or her own leadership skills. The leader should ask self-reflecting, qualitative questions such as, was my message clearly stated, or did I dominate the group? Our text suggests using instruments such as the Group Leadership Self-Efficacy Instrument, or the GLSI, or the Hill Interaction Matrix, HIM, to examine objectively the extent that the group is progressing towards meeting its goals. One of the methods to evaluate the success of the group is to use pre- and post-tests to allow each member and the counselor to recognize the improvements the participants have made as a result of the group. A post-group session is also a method to assess the group. This session may occur a few weeks after the last session to discuss with the group their use of the techniques they learned in the group and to see if they are applying what they have learned in their own environments and personal circumstances. Another way to test group success is to measure each individual's success as well as to measure the success of the group. Behavioral objectives should be set for each member of the group to know whether these objectives are met at the conclusion of the group. A self-report quality of life evaluation may be beneficial to be collected at baseline before group intervention, and depending on the duration of the group, may occur again halfway through the group process, at the completion of the group, or at the follow-up group session, and a 6-month follow-up via phone or mail. By operationalizing the goals and objectives and having the group be a part of this process makes the group more interdependent, giving meaning to them, and provides a greater degree of satisfaction and group cohesiveness since each member contributes to the success of the other. Each member's objectives should be appropriate and support the group's goal. During the weekly sessions, the counselor may use a group progress note to assess a group interaction and the progress of the individual members. The progress note may address the tone and cohesiveness of the group and other factors the counselor observes in the group as important to move the group forward. The counselor or co-leaders review these notes regularly as well as at the end of the group to reflect on the sessions to identify needed improvements in group process and outcome. Another area to look at is whether the members of the group attended all sessions, and if not, delve into the reasons for not coming back. This can be done by a phone call or conversation with the member during individual counseling, if that member attends individual counseling sessions. The members of the group may also complete a questionnaire or evaluation about the content of the group, the number and length of the sessions, the leadership of the counselors, and the value of the group activities, and how they have changed as a result of the group. The evaluation can be done through an interview, online, checklist, or questionnaire. Our text suggests that members use a daybook as an ongoing self-exploration tool. This method is similar to a diary. However, instead of merely a chronicle of events, the member uses this method to write about one's own feelings, ongoing feelings, as they experience them in the group. Lastly, groups may be formally evaluated using standardized measures and recognized research methods to test group effectiveness. The investigators then use this data to add to the body of knowledge of groups, not simply for the present group, but to benefit the entire counseling profession.